really meaningful, what is called operational excellence in healthcare. So we have all dignitaries on the dais. We have our friend Vice Chancellor Dr. M. K. Ramesh. We have Vijay Agarwal, Lalu Joseph, and Usha Manjunath, and a battery of dignitaries. We have senior bureaucrat, C.S. Kedar is with us, then Mr. Nagendra Swami, the host of friends here. So, in fact, today, the hospital management, healthcare management is a profession by itself. So this is one area. You can always manage 10 industries, but to manage one hospital or one medical institution, it is extremely difficult. And if you look at the anatomy and the hospital administration is as complex as human anatomy, is as difficult, complex as human physiology. Today the expectations of people are sky high. Even they want even a dead person walk home. That is the level of expectation the public has got. For a couple of reasons, patients come to the hospital. Number one, they should have a faith in that organization. They should have a trust in that organization. And also the affordability and accessibility are also important. These are the 3-4 reasons why a particular patient prefers a particular hospital, because number one, there has to be a faith, there has to be a trust, and of course, most important is the quality care. So the bottom line is quality care. So today, hospital administration, of course, we have hundreds and hundreds of young hospital administrators. Some of them are already into administration, so they are going to the future hospital administrators. We have CEOs, we have, many students of hospital management. So one of the problem of hospital management is particularly it should be a patient-centric administration, patient-centric. As an hospital administrator, because of course I was looking at the promo video, so they were showing the heart, they were showing hands. So I think shaking hands in very pleasant situation or when you are very happy is not important. Holding hands is important. Shaking hands is not important. Holding hands in those crisis moments is important, very, very important. And hospital administrators are the heart of the hospital, while the doctors, nurses and the supporting staff, they are the brains of the hospital. And this is where our objective is to provide a quality care to the cross section of the society, and at the same time, so there are various challenges one has to face. So as an administrator, you should have a tremendous patience. Patience is the key word. You should have patience for patients. You should have patience for patients attenders. Because these always a successful administrator will have 3-4 things in common. They should have patience, they should have silence, momentary silence, they should have tolerance, and of course they should have always have a smile. So these couple of things makes a particular administrator a more successful one. Because patience makes you mentally strong, and momentary silence will make you emotionally strong. And of course, smile is the best thing, because you see any...
In fact, Manjunath has given a detailed advice to you. And he's the right person because he is heading the hospital and he has been building it for a long time. And my code is different. Still, but it looks very nice to see so many future health administrators sitting here. I didn't expect this much crowd. I thought it's going to be a student sort of conference and like CME, and it's nice. Actually, if you see, the government has propagated heal in India with the intention that India will emerge as the health tourism destination in the future. And you people are going to be the torch bearers of that motto of India, rather of that aim of India. Because I am a surgeon, Dr. Manjunath was a cardiologist. When I treat one patient. But as entrepreneurs, you are force multipliers. You are going to create the systems. You are going to build the hospitals. Like I said, here in India project, the idea is to make the destination of health tourism. Why? Europe is very well developed. America is very much advanced. How can you aspire to become health tourism country of the world? There are various reasons. One is we are cheap. Cost is very less. For example, one circumcision may cost around $1,000. That means 1 lakh rupees in UK. Here you can get it around 10,000 rupees. And the waiting list. Again in UK, to get one hernia done in a NHS hospital, it's 1 year waiting list. Here you can get admitted in the morning, tomorrow you can be discharged. Another is English speaking population. One more thing is the skilled manpower, abundantly available healthcare manpower. It's good or bad, we have a lot of medical colleges, a lot of healthcare institutions, a lot of nursing homes, nursing colleges. We have got good supply of healthcare. And one more thing, it has history. People will be interested to know. So the idea is to entice them to come here with all these things and make them stay here for 1 week or 2 weeks. They get operated and get the treatment, tour around the country and go back. This requires a lot of infrastructure and contribution from our side, in fact from your side, because you are going to be the future healthcare professionals, healthcare entrepreneurs. If I am right, actually all of you, maybe doctors are also there, nurses are there.
And with my friends, Dr. Joseph, Amita Manda, PT, and Usha Manjunath. And definitely, you invite so much when you are interacting with the young energy that I see from seeing this young hospital budding administrators. I think Dr. Manjunath and Dr. Ramesh both kind of set one thing very, very clearly, that running one hospital he said that it's more difficult than running 10 industries, and Dr. Ramesh said that it's more difficult than running 1,000 colleges. The issue is that, to my mind, the only success mantra for running a good organization is going to be your leadership qualities. Now, these leadership qualities, how do we become a leader? Unfortunately or fortunately, I mean, just like you will pass out your hospital administration course, or like I did my MBBS and MD, so there is a kind of an end point, and you say you get a stamp and you become a doctor, and you become a nurse, or you become a physiotherapist. Unfortunately, there is so far no course where I can get a stamp and I say, all right, I have now become a leader. But fortunately, each one of us, right from young age, start developing leadership qualities. So is there a kind of an end point of becoming a leader? That can only be, for example, when you see people like, whether it is person like Anna Hazare, or it is a person like Malala Yousafzai. I mean, this young girl at the age of 17 years has gotten the Nobel Prize. She is the youngest Nobel Prize winner. Or you have Mahendra Singh Dhoni, who comes from a very, very tier 3 town and goes on to become an icon or you have Steve Jobs, or any one of these people, whenever their picture you are able to see, alright, you say, alright, have I reached? Probably they have reached a destination of being called a leader. The issue is that, as I said, each one of us are developing some kind of a leadership qualities within ourselves. And I try to say that it is related to some kind of an energy which is a very peculiar mix of various things, and I can try to say, all right, can we think of a recipe of becoming a leader? And this recipe is going to be considered or consisting of some of the important energies that we have to think about. One is the mental energy. And in this mental energy, first thing is to stay curious, keep learning, keep reading books, do whatever. And see, you will realize that, and you will listen probably or read about the life stories of the people whom you may feel are leaders. Like, let's say if you look at Steve Jobs, now this person was not able to pursue his proper college education because of the financial problems. Lot of traits that were already talked about by previous speakers of Manjunath and all can only come up if you are harnessing your emotional intelligence. You have to learn to identify and manage your emotions as well as understand those of others. Just like what Dr. Manjunath said, that this moment of silence or moment of remaining, that is what will help you understand.
A gamut of experience and wealth of knowledge. CAHO SAKCON 2023 with the pre-conferences highlights and so much more to come.